Hello, everyone, and welcome to this Healthcare IT Today interview. My name is John Lynn, and I'm the founder and chief editor of Healthcare IT Today. And we're excited to talk with Pete McCabe, CEO of Ciox. Welcome, Pete.
Thanks, John. Thrilled to be here.
Yeah, so I'm excited to talk about this. Unfortunately, we were supposed to meet at HIMSS, which would have been much more fun in person. We could have shaken hands, but it seems like all of that's out of the door now. But yeah, so for those that aren't familiar with Ciox, tell us about yourself and Ciox.
Yeah, so look, just a 2 cents of me. I'm an engineer by education. I've worked all over industry, in aerospace and plastics and transportation and
Wow.
renewable energy and shared services, but I've spent a good 12, 15 years in healthcare all across the world. What Ciox is we're the largest clinical data exchange in the country. We sit in 3,000 hospitals and 16,000 clinics. And on behalf of those providers, we move about 100 million patient records a year, all to the highest standards of compliance with HIPAA and, billions of transactions behind it.
That's awesome. It's hard to imagine the volume you do, especially with all the compliance regulations. But I guess that's really why we wanted to have a conversation. I think it would be inappropriate to not lead off this conversation with some COVID-19 discussion. So, what are the lessons that you've really been seeing and that we've really been learning about interoperability in this current COVID-19 environment?
Yeah, look, I think a couple of things. First off, we are operating as normal today and working hand in hand and with our provider customers in getting our teams working from home wherever that's possible, and where that's not possible, taking all the appropriate safety precautions and social distancing precautions. So we feel great, and our customers feel great about continuing operations. I think the big piece is what we're all driving for is interoperability. And where we have digital connections, it's a non-event. The COVID is a non-issue. And of course, where we don't have digital connections, it's a material event. We've got to talk about face masks in the front desk and distancing and rotating shifts and so on and so on. So we're advanced. I think what the big lesson is, we need to accelerate interoperability. This is shine a magnifying glass on how good it can be and how much work we still have left to do to achieve the full potential out there.
Yeah, I mean, I think you guys are in a unique position because many of your workforce were working remotely already for many organizations. I know you always had a hybrid, some in-house, some separate, depending on the organizational's requests. But it seems like, you were already enabled to do this type of remote work, and now it's just accelerating that for many organizations who hadn't embraced it. Is that kind of where you're at?
That's absolutely it. We made big investments in a software platform. We call it Health Source, which enables you to process those 100 million records at 4 going on 5 nines sort of accuracy and compliance with remotely. So you have this platform. And then we had let's say about 35% of our customers we were supporting remotely. We're now at 60%. And we're able to move that fast in a matter of weeks with that platform enabling all of that. So it's exciting, really exciting.
Yeah. So we've been talking about interoperability for, I mean, at least the last decade. I mean, probably even well beyond that. But I'd say in the last decade, the technology has been there to really make it a reality. Why hasn't there been more of an improvement in interoperability than what we've seen today?
Yeah, and I would argue it's decades, not just one decade. I remember early in my career, somebody talking in the late 80s about interoperability being double solved in a couple of years, and of course it hasn't. I think there's 2 big dynamics. One is it's incredibly complex. So we alone at Ciox deal with over 400 EMRs. So you got hundreds of technology platforms, and we deal across over 20,000 different organizations. So you got thousands of unique organizations. And every one of those has their unique standards and approaches and processes. So you got millions of different standards and processes. So when you put all that on, you got an exponential level of complexity in there. We could talk about why and how, and but that's the reality we live in, right? That's reality as it is, right? Hundreds of EMR systems, thousands of independent organizations, millions of different approaches and standards. And so that's what interoperability is. And then you overlay that with privacy, right? And healthcare information is the most personal of personal information. And so you can't afford to make mistakes. I think those two sort of underlying pillars, if you will, of the problem set is why it's been so challenging.
Well, and you bring up an interesting point. I mean, it's amazing you're working with 400 EHR vendors, which, has always illustrated one of the challenges of interoperability to me. Although, I mean, some of them are much bigger than others and could solve this problem much better than maybe some of the smaller shops. But that aside, I mean, I've always argued that the reason that interoperability hasn't happened is the customer hasn't demanded it. So, like when, a lot of people say, why haven't the EHRs solved this problem? And we spent $36 billion of stimulus money on this and ONC has failed us, which I think is just is not the right way to look at it. But, really, why haven't these EHR vendors solved it? Is it, as I'm kind of asserting here, that it's the customers didn't want it, or are there other challenges that are in play as well?
Look, I think I hadn't thought about it that way, John, but look, I think the customers haven't pulled for it, right? There's not a compelling value proposition for the EHRs. I think the EHRs have done a nice job at solving interoperability within their system, within their domain and in their scope, and I think they've done nice. But again, the average hospital we deal with has 16 EHRs. So inside of every one of those EHRs, it's nice, it's tight, it's complete, the data talks, there's variation from one to the next, but they're pretty good. But now you got hospitals got 16 and they have different specialties, and then the hospital buys another hospital and they merge with another hospital and they acquire, and then the next release of the next EHR comes out, and you just kind of get that complexity building and building and building. So I think the EHRs within the scope that their customers are looking for from them have solved it well. I think that to your point is that there hasn't been a burning platform from the customer back, from the provider back, that says solve interoperability. Now look, we deal with them every day and they hate it. Everybody wants it to be more interoperability, but everybody, there's no magic pixie dust to do that. It's hard work, it's real dollars, it's real expense, it's real change. And I think the value to the provider or to some in the healthcare system hasn't reached a level to make that kind of investment yet. And that's why, frankly, they need folks like us and what we do.
So what are the benefits that your customers are seeing from interoperability? Like what is the magic pixie dust, if you will, which I don't think there is, right?
Yeah.
But, and you would think that improved outcomes would be a enough benefit to do that. But I think that's that calculus is a little hard. But what are the benefits that are really driving your customers to be interoperable?
Yeah, look, that I'll give you two levels. Clearly, our healthcare system is, as you know, John, it's not sustainable, right? It's 17% of GDP. Its costs are growing twice as fast as the GDP is growing out there. And our quality performance isn't in the top quartile of the world. So it doesn't work, right? When your basic expenses growing twice the rate of your income, you end up in a bad place, right? So how do you start to bend that curve and put a dent in that problem set? One answer is, look, you've got to be able to deliver higher quality care for less cost. And so how do you do that? Well, the data and the hidden insights that are out there in these medical records clearly has the potential to be able to do that, to be able to drive better outcomes at lower costs. We see it all over the world and industry and Google and everything we do today. So that's the big nirvana right out there. And it's not a wild dream. There's case studies where it happens every day. But the truth is, to your specific question, our providers, it's administration efficiency. it starts with serving the patient. Like, so when the patient comes, or my mom, and she has, and I get lots of feedback from her, and needs a medical record, let's serve that patient well, because it has to start with the patient, and we have to empower those patients. So, let's provide better service to our patients, and then let's provide better service to our care network, and we're able to do that in a big way. Let's provide a lower friction, lower abrasion service to the government and some of the audits and some of the payers. And I'd say we're doing lots of good work there. I mean, really, really good work. And I think our customers would say that, and we see it every day. So think administrative efficiencies and patient service out there. But the next plateau is clearly, and needs to be, and it's frankly a focus of the government and the recent regulations that came out with 21st Century Cures, is let's start to untap the potential of that data beyond the administrative burden and beyond, empowering the healthcare ecosystem.
Do you think the 21st Century Cures Act is going to kind of force healthcare organizations' hands to be interoperable?
Yeah, look, I think it's a huge step in the right direction. I've been in healthcare long enough to be, to be realistic, that there's no easy button on this thing. The regs aren't going to solve it, but it is a necessary step in the right direction. We've faced the reality of interoperability every day, as I talked about, and it's messy. 400 EMRs, everybody's got a different standard of microfiche paper. It is messy. So yes, we desperately need APIs. We desperately need the standards that are driven out of the Cures Act, and that will take us a big step forward. It will not solve everything, but as we know in healthcare is taking one bite at a time of the elephant. And you take your first, you take your second, you take your third, and someday you've taken a big chunk out of the elephant.
Yeah, as my friend Dr. Nick says, healthcare is incremental. That's how we do it, and it kind of has to be that way. You brought up another challenging point, which is the balance between privacy and privacy requests and interoperability. And often they seem at odds, but how do you guys approach really supporting both of those ideas? And ironically, in this COVID-19 world, many are like, screw privacy, I need health, right? Like, so there's, I even did one of these with a patient who's like, hey, when I'm dying, I don't give a rip about privacy. So there's these interesting challenges we face with it. How do you guys balance it?
Look, I'm an engineer at heart, so I love a highly constrained problem, right? That's what great engineering is, right? Anyway, if you have no constraints, it's really easy. And so this is algebra 2, right? You got to solve for two variables. You got to solve for interoperability and privacy, and we do it every day, and it can be done. It's no different than your financial information, right? You got to solve for efficiency. I do all my banking on my phone, but it's privacy out there. So it can be solved, John. I think that can be a bit of a smoke screen, to be perfectly honest. We fly airplanes every day. My God, I worked in a business that made aircraft engines. You've got to make them cost effectively. You got to sell them, but you got to make them really, really, really safe, right? And so I think everywhere in the world there's examples of kind of walking that balance between sharing and being safe. And in this case, it's being safe with the data out there. So, we've invested lots and lots of systems. We're running at 4 nines accuracy today, so we're not perfect, right? But we're launching a new functionality this week that we believe will take us to 5 nines accuracy. And so it's technology, process, great training gets you there. I don't think you can say throw privacy out. I think that's a big mistake, and I frankly think it's a lazy solution out there. We can solve for both. We're doing it today. There's lots and lots of opportunities to take both interoperability with privacy to an even a higher level than it is today.
Awesome. So if you could change one thing about interoperability, if you had that magic pixie dust we talked about, it doesn't exist. But if you could change one thing or make one request, that would just make interoperability so much easier or better, what would you change?
Yeah, I would change, and John, I'd change the headset. It's a systems problem. It's an ecosystem problem. And people come at it, hey, well, regulation will fix it. Hey, an API will fix it. Hey, my technology solution will fix it. Or my service solution will fix it. None of those will fix it by themselves. Together, they can put a dent in this thing, in a material dent. And what I see, and I might be the first guy you talked about, is look, we don't have the answer. We think we play a role in that solution. And I think if everybody has, the government, the technology companies, the EHRs, the people like us, the patient, if everybody says, hey, look, I know what the goal is. We can bend the curve and transform healthcare for this country, right? I know what's possible. I can see it. I can taste it. And if everybody says this is a systems problem, I've got, I can play a unique role here. You can play a unique role here. I think we solve it. I think the challenge is, and I was guilty of it, everybody will talk about an ecosystem play, but they want to rule the world. They want to control the data. We'll never get there with that headset out there. So I think if we think about a systems play or an ecosystems play, I wish I had it, but that's as close as I can come.
Yeah, well, and that just describes why it's such a challenge, is that not one individual can solve this. It's going to require a community of people who say this matters. So that's great, Pete. Well, we're at the end of our time. So, where can people find out more about Ciox?
Yeah, I'd encourage you to go to our website, cioxhealth.com out there with lots of information from what we're doing with COVID, where we invest in technology, and a lot of our thoughts around, HIPAA compliance, the 21st Century Cures, a lot of what we talked about today. But I encourage your listeners to go there, and I really enjoyed the time, John.
Yeah, thanks so much, Pete, and thanks everyone for watching this interview. If you want to find more great content like this, you can check it out at healthcareittoday.com. Thanks so much. We've been here with Pete McCabe, CEO of Ciox. Thanks, Pete.
Thanks, John.